Hi there, I'm Dan Martin. I'm the politics reporter for the Leicester Mercury, and this is Amy Orton, who's our local democracy reporter.
Hello.
Hello. For the past 100 days or so, Amy and I have pretty much written about nothing but the Leicester lockdown, because this is a kind of unwanted milestone for the city. And we just thought we'd come on and barge into your Facebook and have a little chat about some of the issues that have been going on over the past, 100 days, and where we are now and where we might go. So I don't know where we're going to start, really. What do you think, Amy?
I think that's well, first, if anyone's got any questions, we're definitely not promising that we can answer them, because there are some questions that we've asked from 100 days ago and we still haven't had an answer to. But if we can answer them, then we will. But they also might prove to be good talking points. So send us some questions, and then shall we look through some of the photos and reflect?
Do you know what? We will, actually, because if you've looked at the Leicestershire Live website already today, you will have seen that we have done quite a lot of stories about this anniversary, if you want to call it that. It's not really something to celebrate, but one of the interesting ones we did, our photographers who have been out during lockdown and taken quite a load of pictures, they have put together a story which I'm just trying to bring up on screen. It's like a gallery, and if I can do this correctly, you think I'd have got the hang of this by now, but bear with me just a moment. Some questions are coming in as well, so that's a good sign. Thank you very much for that. And wait with me. This is what I was talking about. So it's what we've done while we just get some questions coming. 35 photos that tell the story of Leicester's 100 days of lockdown. We all know this guy by now. I think next November, if we're allowed to go to bonfire night, people will be sort of walking down the street on the way to Braunston Park saying penny for the mat, because he's not the most popular chap in Leicester at the moment, because it's his decisions that have kept us in lockdown for 100 days. And that's him. Actually, we're going back a little bit before 100 days here, aren't we, Amy? Just tell us about what happened then, if you can remember it.
Yeah, I think it was just a random, when the daily briefing was still a thing, and somebody asked Matt Hancock about what would happen if there was an outbreak somewhere, and he said, well, actually, we are dealing with an outbreak in Leicester, which was news to all of us at the time. I think even people fairly high up in the city didn't know the extent of what was going on, because the data just wasn't there at that time. I don't know if this is boring, but the Pillar 1 data, which relates to the hospitals and care homes and things like that, was being published, but the Pillar 2 data, so all of the results from testing centres that were kind of started cropping up on the corners and at leisure centres and stuff in the city, we had no idea what the results were from those. So this was when Matt Hancock sort of dropped that bombshell, and from then it kind of just went a bit mad.
It was, in fact, I think, pretty much a surprise for everyone, and we were all kind of scrambling around to get an answer to what he actually meant by we had an outbreak, and we were only able to get that from the city council. I think it was the next day, or when they told us that we had an outbreak in June that was local to the city, and our infection rate was 135 cases per 100,000 people. Now, later we're going to talk about where we are, and we're going to talk about a second spike, and that figure, which seemed so very high to us then, is going to look pretty small, but we'll come back to that point in a bit, and we'll just move on, because it was a couple of weeks after, wasn't it, getting towards the end of June, when Mr. Hancock again stood up in the House of Commons and announced the first local lockdown. There'd been some speculation about it in the press. We'd written some things about it. There started to be leaks from government, and he then got up quite late, I seem to remember, in the House of Commons, and said he was overnight going to shut our schools down. School is actually more or less, they stopped for the summer anyway, but then he shut on non-essential retail. So that there is one of the first days of local lockdown. You can see it's really, really quiet. There's a police car there as well, because I think at the time there was some concern about whether people would stick to the rules or not. So there's going to be some enforcement. But I mean, effectively, there were lots and lots and lots of empty streets. And it was a very weird and eerie time, wasn't it? But what are we talking about here, Amy? This is testing, isn't it?
Well, testing, and I think that was maybe one of the first clues that we got that something was going on in the city, because these mobile testing units started cropping up everywhere, and then it got to the point where the army had been called in. So the testing was just a massive effort citywide, and it was scaled up pretty much all over the city at that point. And that's when the results started to come in, and that's when we were able to see what we were being told by politicians, by the government, reflecting in the data, that we were actually able to sort of track it and see that what they were saying was that we had really high cases here. So
in fact, it's interesting actually that we've sort of come in a circle now, and where the trustworthiness of the data has been a big issue of late. But we'll come back to the bit. What is interesting about this, at the time, I think we had 10% of the country's entire testing capacity, didn't we? When we were the only place in the country to have local restrictions imposed.
I think our rate was 3 times higher than the next one on the list, which was, I think maybe it was Blackburn. So at that point, we were massively out ahead of anywhere else, and the rate seemed unbelievably high. But like you've sort of already mentioned, that's not really the case now when we see the rates elsewhere in the country.
This, by the way, is one of my favourite photos from lockdown, because you're trying to imagine what conversation these two are having there at that moment in time. It could be anything, but it's quite an interesting one. As I say, the police were out in force at the start of it. They were issuing a few fines. I think they issued. Well, actually, talk about the fines if you can, because one of the big things about lockdown, Amy, is have the police actually been enforcing it? And you wrote something about that recently, didn't you?
Yeah, I did. So in the national lockdown, I think there was sort of 450-ish fines handed out. That's sort of dropped off in the local lockdown, I think, to 22nd of September. I think so. From July the 4th to sort of late September, there'd only been 34 handed out. But then sort of the end of last week, we started to see fines being given out to people having house parties. I think you wrote about one of those, Dan. And someone having speakers confiscated for playing really loud music. So I think it's perhaps just taken a while to bed in, and those new rules to sort of take force and for the police to be able to use them properly.
Yeah, here's an interesting picture as well, actually, just while I find it. I mean, I suspect that's Thomas Cook. I suspect because he's made of bronze, he might have a mask exemption. But obviously, at the start of lockdown here, we didn't really have any face covering rules. That came in a bit later, but someone obviously decided to decorate him. This is saying thank you to our NHS key workers, I think, isn't it? When they started lighting up buildings, I think they did City Hall. That's the Victoria Park memorial there. We'll just wing through here these because I've seen quite a few questions coming in, and we'll talk about those in a bit. What else have we got? Yeah, there's Sir Peter. He's the Mayor of Leicester. If you don't know, you probably do. He had an interesting time, has had an interesting time from the start of lockdown, having some disagreements with the government about how much data they've been able to provide to the city council to help us actually fight the virus. I hate that phrase, fight the virus. Don't fight a virus, you just deal with it. People talk about battles and that kind of language, and I don't think it's particularly helpful. But yeah, he I think used to be quite integral to the process of deciding what the rules were and where it will come in. But as there were more falling out between local politicians and the government, I think the government sort of squeezed the city council out of it a little bit, and now we've got to a situation, Amy, I think, haven't we, where they find out about the rules at pretty much the same time everyone else does. I mean, what's been going on? Talk about the communications and so on and so forth, if you can.
Yeah, I think it's just been difficult in terms of what we've been able to say, because obviously people are turning to us to try and find out information. I've noticed a couple of people already in the comments saying, "Oh, let's see some more made up news," and things like that. And it's something that we've heard a lot of. Yeah. And it's hard to kind of convey to people how difficult it is sometimes to get the answers to the questions that they're asking us, because we don't receive emails from readers. We don't see these questions come up and think, oh, we're not asking that. We always do ask. We try and find out the answers. But it's really not as easy as I think we wrote not long ago about the fact that we've asked for Matt Hancock to be interviewed by us pretty much every day from the start of the local lockdown until sort of the end of August, September time, where we just were being rebuffed, and we never ever got that interview, despite him appearing on national telly, national radio, all the others. He's never really spoke to us, and he's the person that can answer these questions, and he's the one that we want to answer these questions. And we've just, unfortunately, we've not been able to arrange that. It's been a frustration.
No, I mean, we do, don't we? We ask regularly, and the Department of Health and Social Care haven't exactly been the easiest squeaky door to kick open. In fact, they've been jammed shut quite often, and we do try, honestly, and we'll keep trying. Sometimes we get lucky, sometimes we don't. But these days, the interesting thing about it is that everyone can get access to figures, and I don't know whether it might be worth actually taking a look at some figures. Or should we do that in a bit? Let's just have a look at some more questions. It's what can we get? There's someone there asking if we're about to go into a second national lockdown, or how long will this lockdown last? That's a common question. I think the answer is we don't know. I mean, we're on 100 days now, and we can't honestly tell people that we won't be having another one of these Facebook Live sessions for 200 days, can we, with the way things are going?
No. Because I think the other one that seems to be doing the rounds today is have the local lockdowns worked? Yeah. And there's arguments for and against what's happened in Leicester, because at one point, I think, so July the 24th was the day when we'd had the most cases reported, and that was 97 cases in one day. Today, I think there's been 51 cases reported, so almost half of what was going on then. But then you've got the issue where at the end of August, the rate got down to 23.1, I think it was, per 100,000 from 135 per 100,000. And we still didn't come out of local lockdown then. And now that rate's gone back up in line with everywhere else. So it's not just a Leicester thing that we're seeing now. At the very beginning of all of this, it was just a Leicester thing. Now it seems to be sort of mirroring what's going on elsewhere in the country. And it's hard to imagine that the restrictions will be lifted here when the rate is 120, when they didn't lift them when it was 23.
You see, that's interesting, isn't it? Because this is one of our frustrations, and we probably say this to the sound of the world's smallest violin, but we have repeatedly asked the Department of Health and Social Care to give us the trigger points for getting out of local lockdown, and they never have. They always sort of send back the most a kind of generic statement saying they take the action they take to save lives, which is true. I mean, I don't think anyone doubts the lockdown measures in the early stages, and even then have probably saved lives. We saw that when the infection rates came down to those levels you talked about at 22. But if we weren't going to get out then, when were we going to get out? And the other point about it is how do you deem or how do you judge a successful lockdown? I guess a lockdown is only successful when you come out of it. And how many areas have we got in local lockdown at the moment across the country now? Because we're not alone anymore. I mean,
there's so many, isn't there?
Yeah, I think it's 20. And as far as I'm aware, and someone will probably correct me, only Luton has ever managed to escape local lockdowns during reviews. And as soon as they released the measures there, the rate started to climb again. It's a really tricky one. I mean, we've got another review, I think, at the end of this week, haven't we?
Yeah, on Friday there's another one, and it's hard, like we were just saying, it's hard to see how they'll change that, because it will. It's been lower than it is now. And sorry, I've got a kid just come in asking if he can have a snack. Yes, go on.
Right. Do you want me to take over while you feed your children?
I just said yes.
I'm gonna jam it.
There's a review on Friday, and we don't really know. It's hard to be able to say what is going to happen or what isn't going to happen. Like we say, when we know that the rates have gone down and they've now gone back up again. And you and I both know that predicting what's going to happen has been absolutely worthless, because it's never gone the way that we thought it would. More or less every time something has changed, and it's been something that we didn't expect to happen.
Yeah, it's a bit of a most game trying to predict what will happen. But that's where we're actually just let's just go back a bit, if we can, if nobody minds, to the start of this, because we talk about it being a Leicester lockdown, but at the beginning of 100 days, it wasn't just a Leicester lockdown, was it? I mean, and you'll all know this, forgive us, but part of the reason we're on here today is just to recap on 100 days. We had elements of the county included, and strangely, we've gone full circle, haven't we, with Oby and Wigston? What's happened there?
Well, and it is still happening there as well. It's maybe sort of similar to what you were saying about Luton. They were lumped in to begin with. They were in the red line. They came out, and the rates have shot up, and they're continuing to rise there as well. I think that they're the only district in the county now that's got a rate above the national average, which is, I think, 107 per 100,000 people. So it's been one of those things that's been talked about, and we're not entirely sure. And we ask, and public health bosses will talk to us about what's going on in Oby and Wigston. To begin with, I think there was some concern about car sharing and the factories and things like that over there. But now it's really hard to say what the cause is. I think it's how the one reason that everything comes back to is household transmission, which is obviously why that rule still remains in place about not mixing with the households and not meeting people from other families and seeing your friends and things like that. But the household transmission thing is always the one restriction that remains, and is always a reason. Whenever we're given a list of reasons why rates might be high, that always features, doesn't it?
It does. I mean, there was some initial discussion that in Leicester the problem might have been about workplaces, and I think on analysis of the figures, it's proved that may not be the case. I mean, there's an element of that, and we've done stories about factories where there've been outbreaks. I mean, more recently, actually, we've done stories about some outbreaks on the university camp. I call them outbreaks. I mean, they're quite small numbers, but I think universities, for example, define something like 2 or more cases an outbreak. So it's just the use of words is an interesting thing, actually, because I was just debating what an outbreak is there. But some people are saying that they don't actually feel like we're in a lockdown anymore, even though we have restrictions that stop us meeting and going to each other's houses. I was thinking about this the other night, and when we first went into local restrictions, we were told it was going to be essential travel only, and that really it was like winding the clock back to the national lockdown. And that felt when we could only go out for, and it's even weird to say it now, isn't it, one bit of exercise a week, but suddenly we're right back, and it was kind of stay at home if you have to. Now we're not there anymore with a national picture. We're not even there in Leicester. But I think if people are able to travel freely, they might not feel they're under lockdown. I mean, what do you think?
Well, I think it's definitely shifted. I think just when the pubs, I mean, when the local lockdown first started, the rest of the country that was the weekend the pubs were all opening and things like that. So I think that's what, at the time, sort of non-essential retail, pubs, restaurants, things like that weren't able to open in Leicester. Hairdressers. I know you suffered with that, Dan. All that sort of stuff. All of that sort of stuff wasn't able to open. So that kind of felt like that did set us apart from everywhere else. And slowly but surely, that all those sort of sectors of the economy have started to open up. And so you can now go for a meal. You can go to the pub. You can. Gyms were closed for longer. All that sort of stuff has happened in Leicester. So I think maybe and the biggest one would be schools, like. With children being back at school, I know for me especially, that just felt like things were way more normal than they've been for a long time when the children all started going back to school. So maybe that sort of contributes to the fact that people don't feel like we're in a lockdown anymore, because we're not in a full lockdown, but the case remains that there are people in the city that won't have been able to see their family now for sort of coming up for 200 days. It will be at this weekend, because the national lockdown was 100 days, and then this one is 100 days as well now.
Yeah, I mean, I think we had, the shielding period is stopped. For people who don't know, and you probably do, shielding was the advice given to clinically vulnerable people who might be more at risk of falling ill from coronavirus, just simply to stay at home. And there are, or were, about 14,000 of them in the city. And as Amy said, they wouldn't have been going anywhere for quite a period of time. Now, shielding came to an end on October
Monday. It was Monday.
Yeah, indeed. So I don't know what's if anyone is watching who is shielding and you want to put a comment in and tell us how you feel about it. Because we kind of said we'd try and answer your questions if we could, but if we might have some questions for other people, just maybe to tell us what they think about it. I'm just looking at some of the questions here. Are we experts in the field? No, we're not. Hang on. I'm going to do this because we get a lot of this. But Roger says we're conspiracy theorists who regurgitate rubbish. I'm going to regret asking this, Roger. But if you want to elaborate a little bit, we'll come back to you in a while. We're not. I mean, should we try and nail this? I mean, we try and stick to the facts as far as we can. We when we report things, we hope we don't enrage people. I mean, people sometimes accuse us of scaremongering. Sometimes the situation has simply just been a bit scary. I mean, yeah, people always say most people recover from coronavirus. They do, and it's great that they do. But there have been, how many people have died in Leicester, Amy? It's,
in Leicester's hospitals. So there's more than this that died from Leicester and Leicestershire, but in Leicester's hospitals today there were 3 more, so that's 453, and 9 of those deaths were in September. And they were all after the 16th of September. So there was a 2-week period where the NHS data seems to suggest that there were no deaths in the city. And now, obviously, that's starting. And I think there's some hospital admissions data as well that shows that while it's nowhere near the level it was when all this started, it is creeping back up again. I think the difficulty is that we're trying to tell people things that they don't want to know, which isn't an easy thing to do sometimes, because we know from the number of people that read certain things that readers are interested in the cases each day. They do want to know what the infection rates are, because they use that to try and figure out for themselves what might happen next. And as we've kind of alluded to already, it is really, really difficult to work that out, because we're now at a point where, I don't know, maybe Dan, we could talk about some of the rates elsewhere. And we know that Manchester now is one. I think they've got their rates 530, and
do you know what? Actually, I just brought up on screen, and people might be able to see it there, just to kind of prove a point about hospital admissions, because people always ask us about it. But that was the peak of the sort of pandemic, and we're going back to April there, and you saw it start to come down, and then when we get into June, they go up a bit, and that's sort of around the period we had our local outbreak. And these are Leicester figures, by the way, so we're talking about people who have been admitted to UHL, to Glenfield, and to the General. And then they went right down, and now you just see, I mean, these are figures that are only up to date up to the 25th, but it's a little bit of an uptick. And people just, you know, we have reported public health experts and their views on this. People like Ivan Brown, who's the city's Director of Public Health, and Mike Sands out in the county, because although these are Leicester figures, they're not all Leicester people necessarily. It's important to say that. I mean, if you fall ill from coronavirus in Loughborough, you're going to end up maybe in the Leicester Royal Infirmary. So, but all public health figures will tell you that if the trend continues and we end up in a second spike, even though we're not seeing it necessarily at the moment, the hospital admissions will continue to rise. Eventually they'll catch up with the cases, and unfortunately there will be more deaths. Now that's the professional view on it. A lot of people don't like it, a lot of people don't want to believe it, but at some point, you know, you think maybe you have to start trusting the people whose jobs it is to look into this and to watch these figures and see how they impact. But yeah, shall I do you want to talk about something else? Well, I'll just get those alternative figures up on screen so we can see where we are compared to everyone else. It says throwing you under the bus.
Yeah, no, that's fine, because I think one of the things I just sort of went off on a bit of a tangent there about other areas, but I've written about the 7-day rate in Leicester today, which is now at about 120. So compared to the 135 it was when we went into the local lockdown, we're nearly sort of at that point. And there's been a lot of talk about Nottingham, and it's hard to see that they won't go into a local lockdown towards the end of the week when the lockdowns are announced there, with a rate 3-4 times higher than ours was when we went into our local lockdown. So that there is sort of the difficulty in terms of seeing when we will come out of this or how we will come out of this. And obviously a lot of people are concerned that this Leicester lockdown won't end before another national lockdown begins, which is something we've heard sort of Boris Johnson say there won't be a national lockdown again. But I mean, I don't think anyone can say anything for certain at the moment. We've learned that throughout this whole thing, really.
Yeah. Hopefully, actually, what you can see now on the screen in front of you is this is an NHS website which updates daily, and the figure that we've sort of been using to illustrate everything is this figure here, which is case rate per 100,000, and it sort of, these are all the local areas in England. And if you remember when Leicester, we said this earlier, that's the average now, by the way, 107.3 cases per 100,000 people. When Leicester went into local lockdown, we were, I'm just going to make it actually, yeah, that's better. We were somewhere way down
like
here.
47th or something in that list now. And if you think at the time we went into local lockdown, we were top of that list, but we weren't just top of that list, we were way out in front of anyone else. So
but what's happened is everyone has started leapfrogging us, haven't they?
Yeah.
That's the
it's not necessarily our rate has gone down. I think it's other areas' rates have gone up.
But what is it that we think actually? Because if you see, like in Manchester, the rate has galloped away, and it has in Liverpool as well. And those are obviously bigger cities than Leicester. But our rate, while it has gone back up from that low 20s, isn't anywhere near what it is in parts of the north of England now, which is a good thing, I guess. Here we are, so we're on 120.2. Still, higher than the national average, and not where any of us would want to be. But I heard it argued that because we've been through 100 days of lockdown, and we've had quite intensive intervention, longer than anyone else, that might have protected us slightly from the second spike. But I suppose we'll only know as the days and weeks progress what's going to happen next.
Yeah, well, we never know what's going to happen next, really, do we? That's one of the difficulties.
Yeah, indeed. So I'm just looking at some of the other questions. Yeah, oh dear. Not everyone's liking what we're talking about, but but we'll press on. It can't be helped, can it? Thank you for people to say.
There seems to be sort of a lot of people saying that they don't see people sticking to the rules anymore, which I think you wrote something down the other week about lockdown fatigue, which is basically like people just not only, and I think in a lot of cases what we find is it's people not necessarily flouting the rules and having parties for hundreds of people in their back garden. It's more people not knowing what the rules are and not realising that those rules are still in place, because they have been in place for so long. And if you watch, if you watch the news or at night, and they'll talk about the rule of 6 and they'll talk about the rules elsewhere. And the problem we've got now is there's all these different local lockdowns, and they've all got different rules attached to them. And so the Northeast has got a whole other set of rules to us. And the Northwest, they were talking today about potentially issues with pubs up there. So there might be extra restrictions on pubs, which we haven't got at the moment. And so what happened, there's no sort of straight, you're in a local lockdown, this is your rules. It's all a bit like, we'll check the website. Even Boris Johnson, we saw him last week, not able to answer questions about it.
This is the website, the one you're supposed to Google and have a look at, Leicester local restrictions. And I have to say, I know a lot of people who have gone to it to find out what they can and can't do, and even been left a little bit confused about it.
We've done that ourselves.
Yeah.
On some occasions, people have sent it to us and said, oh, can I meet my granddaughter in the park? She lives in the city, I live in the county. And as we understood it, you could. But then when we checked with the Department of Health, they said, no, you can't. That's against advice, but not against the law. And that's the other thing. Some of this stuff is there are laws to stop you from doing things. And then the rest of it is guidance or advice. And there's that sort of, I don't think people necessarily know which one would land you with a fine and which would just see you with a bit of a ticking off if someone break that guidance or rule or law, whatever it might be.
Well, the Prime Minister tells us to use our common sense, but at the same time be fearless and stuff like that. It's the message. There is some fatigue with the message. I mean, I saw someone, Steve, said in the questions there, lockdown fatigue. What kind of excuse is that? Well, it's not necessarily lockdown fatigue. It's fatigue with not being able to understand the messages and everything. The rules keeping changing, and as I say, we used to have a sort of clear review date every couple of weeks. We've got another one coming up where I don't think we're expecting too much to change, but then in the middle of that, sometimes you get a little tweak, and a line would be put out on the bottom of a Department of Health and Social Care press office about north of England restrictions, and there will be Leicester, and then you find out, but it would really be in the small print. So it is tricky for people to find out, and I really do understand why some people struggle with it.
It's not been easy to navigate a lot of the time, and like you say, I think that got almost worse when the Northwest sort of those lockdowns started, because Leicester became a bit of an afterthought in that there was no one specifically addressed what the measures were in Leicester anymore. They just tagged us on the end of another email or an iPhone note. There was one Twitter one night, wasn't there, where Matt Hancock shared his iPhone note saying, and Leicester, and it literally just said at the bottom and Leicester, and that's hard to work with as well, because when people are so confused and they feel like they're not being thought about and they feel forgotten, then that must add to that sort of feeling of lockdown fatigue as well.
I'll probably have to say, in fairness to the government, their communications has got better, hasn't it? I mean, they're still not perfect, but it was absolutely monumentally all over the place at the start. I mean, should we go back to day one of local lockdown and the issue of the map? We all remember the map. Yeah. I won't get it up on screen, but absolutely nobody. They told us there was going to be a lockdown area for about 12 hours. There was, and within that, all sorts of restrictions would apply. Within that, there. Well, simply no one knew whether they were in or out. Everyone in the city kind of knew, but if you lived in Birstall or Oadby or even where you are, you're
in Dem Harbour. So we spent the first 2 weeks in, then we came out, and if you remember, after that first 2-week review, there was talk, and I think all of the county came out at that point. I think, and it was, I think it was July They said July the 20th, the restrictions will be lifted, but then it got changed to July the 18th, which was the Saturday. And so it was all a bit of a mismatch then. And at that point, nowhere had been put into a local lockdown. So I'm not obviously defending what happened, because I don't think the communication had been thought out in any way, shape or form. It wasn't good, and it just confused people and it added to the chaos of it all. But I wrote something last week, I think it was, about Dame Mary Nay, who had looked into how lockdown worked in Leicester and what lessons have been learned. And she sort of, as a result of what happened in Leicester and the confusion, she acknowledged that and suggested a checklist for when local lockdowns were announced, which included things like a map being ready, a clear strategy, rules ready to go so that people could share them. And as well, council leaders, local politicians, other local leaders and MPs being briefed on what the restrictions would be before they were publicised, and none of those things happened in Leicester. And if you look at sort of our colleagues in other areas of the country now, it appears that those things still aren't happening either. It all feels a bit last minute reactive sort of.
That is true. I mean, obviously we have sister papers up in Manchester and we have websites covering Yorkshire, and they found it just as confusing when their restrictions came in to work out what was happening and when it was happening as we did. But say gradually, they're going to simplify things though. Should we talk about traffic lights? What do we know about traffic lights? Is this an idea the government's got? Is it coming in, or is it just an idea? I don't know.
I think it's talked about for a couple of weeks, hasn't it? And I think it's going to be harder for them not to do anything about this as time goes on. So I think one of the things, and obviously this is all speculation, so we don't know that this is definitely true, but areas with areas that are under the national average will have one set of rules. So things like your wall of 6, what the rules are currently in Leicestershire, the actual rules. Then if you're between 100 and 200 cases, so Leicester would fall into that bracket now if it did come in, then there'd be extra rules in place. So I think probably similar to what's already in place in Leicester now, so not mixing with households and things like that. And then the top tier, or like the red traffic light maybe, would be areas like Liverpool, Manchester, the North East, where extra restrictions are in place. But I suppose one thing to say is that there's never been a local lockdown like Leicester's since. They've not talked about closing schools elsewhere or non-essential retail elsewhere. And the pub rule, the sort of 10 o'clock pub restaurant rule, that applies everywhere anyway. So that's not sort of a local thing either. So I don't know. Do you think we'll see anything like Leicester again? I don't think we will.
No, I think it was such a bag of cats for the government in the early stage of the 100 days, and things proved so difficult, and it's had a real effect on the city, on city businesses, because again, when the rest of the country was unlocking in terms of hospitality in early July the 4th, I think it was, all our pubs had to remain shut, and quite a few of them, our pubs and restaurants, have never reopened. And if you were to walk through the High Cross, you would see that a lot of the chains there, they've shut down, and a lot of people have lost their jobs. There's an argument that Leicester has been more harshly affected as a city centre than anywhere else by lockdown. And it's easy to see why. And I think the government saw that, got a bit for it, and decided it didn't want to go back down that route. And that's why it's kind of coming up with all these mishmash of complicated local restrictions, which don't or haven't so far involved shutting down non-essential retail and to a lot of extent the hospitality industry. I don't know. We'll see. But I don't think they're going to press the nuclear button again like they did with Leicester unless we go back into a full national lockdown.
Yeah, which hopefully won't happen. I don't
think. Have we talked about Scotland though? Because even this afternoon, I think the SNP government up there has shut down pubs in what they call the Central Belt, which includes Glasgow and Edinburgh, and that'll go down like a bag of cold stick, I guess. But that's going to be for the next 3 weeks. And there was potential talk here about circuit breaker. Now, circuit breaker is a phrase used for a short 2-week national lockdown, which is something the government's been looking at. Now, I don't know where they are with that. I mean, it was discussed a couple of weeks ago, then it was kind of played down. I think there's arguments between Boris Johnson, who might want to do it, and Rishi Sunak, who's the Chancellor of the Vice Chancellor. Anyway, he's a treasurer. Stumble over my words. Because he doesn't want the economic impact of that. But it may get to the point where we're just there. I don't know. But I'm just looking through the questions again, and I'm seeing this might be an indication that it's time for us to knock it on the head, because someone's asked us when will McDonald's full menu return? That is one of the big burning lockdown issues for us. Amy, have you got any ideas on that?
No idea whatsoever. I didn't even realise they didn't have a full menu still. Sorry.
No, it's been a while since I quite fancy one now actually, but I'm actually. I think obviously people are still watching, which is great. But we've been going for 40 minutes now. We talked about lockdown fatigue. I wonder if people might start to have Leicestershire Live Facebook fatigue. It's
send email questions. We do answer them if we can, and we are trying to get answers for those people. And I just one comment that I've seen just about carers and things and people's mental health, which we haven't talked about, and we probably maybe should, and not just squeeze it on the end. Maybe that's worth sort of a discussion in its own right, because that is an issue that people are suffering with. I've spoken to a lot of people that are suffering in terms of their mental health and just really struggling without that face-to-face contact and not knowing, I think, is the main thing that's having an impact on people now, when they'll be able to see their family, when things will return to some sort of normal for them. So we'll plan something in for that, because I think there'll be experts that we can talk to about what's going on there.
Yeah, normal is a weird thing actually. Now we mention it, because can anyone actually remember what normal was? We sent one of our snappers out the other day just into the city centre to do some video vox pops, if you don't know, are just basically interviews, and we asked a few questions, and we're asking people like, when was the last time, can you remember when you last shook someone's hand, and who was it? I cannot remember the last time I shook someone's hand. I mean, most of us, all of us, will probably have had very little physical contact with people outside our families. It's just such a strange world that we live in now, isn't it?
It is weird, and I think I think when Boris first announced the national lockdown, I think certainly for me, the thing that I was worried about was not being able to see people that I knew, like families and things like that, and your friends. And while for me, because obviously I'm not in the full lockdown zone now, that's sort of been relaxed a bit. It's still not normal, and it's hard to see when it will be again. And so for people in Leicester, I just don't know how they've done it. I really do feel for them, because it's difficult.
I can tell you, it's been slightly odd, but again, ever since they, removed the essential travel only, it hasn't really restriction. It hasn't really felt like a lockdown as such. I mean, there are things you can't do, but I was a pretty unsocial individual anyway. I never went around anyone else's house, so I missed out too much. But I know a lot of people have suffered. We're starting to get more questions coming in, but they are sort of a theme that we've talked about. And as I say, the maybe we've gone for 40 minutes now, so probably tested people's patience. But as Amy said, you can get in touch with us via Facebook. You can email us. I should have probably got some links in advance to put up for people to follow, but I haven't. We're going to try and maybe come back later this week with some public health experts, if we can. It's just about pinning a time down there, because they're really busy people at the moment with the second spike going on. but they are much more interesting to listen to than we are. I mean, I wouldn't say we're necessarily winging it, but we don't have a kind of a laser brain for the facts that they do. So if we can get them back, hopefully people come and join us again. And there are. But thank you, Amy, and thank you for everyone who's paid attention. And we'll let you get off and enjoy the rest of your Wednesday afternoon.
Thank you. Bye.